Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a topic that many people are very interested in because it's something that's really vital to your health and to your quality of life. The title of our show today is Don't Let Glaucoma Steal Your Sight. You may not have even heard of the word glaucoma, but most people have and have some familiarity with it, but really don't know the details. So today we have a renowned physician who's really going to walk us through this condition so that at the end of this show, you are going to have some very specific steps to take so that you will not suffer from this problem. So for instance, we are going to be talking about how you can check your own vision and why this is exceedingly important. Unlike any other body part, glaucoma can really sneak up on you. In fact, in the medical world, it's referred to as glaucoma is the sneak thief of vision. Hence our title, Don't Let Glaucoma Steal Your Vision. And the third key point that we're going to be focusing in on is that you may have a predisposition to glaucoma, either through genetics or family history. And we're going to talk about what steps you can take to be tested so that, again, you do not suffer from this condition. But to get into this program and to really have the opportunity to meet Dr. George Spaeth, our guest today, I would like to introduce this renowned physician who we are very fortunate to have here in Philadelphia at Wills Eye Hospital. Dr. Spaeth attended Yale University and is a graduate of the Harvard Medical School, and now he is practicing day-to-day with people at Wills Eye Hospital. In fact, he has had such a long and august career. He has treated hundreds of thousands of people with glaucoma here in the United States and around the world. He has a very long CV, which you can read on the web. But I just want to say that to have his time and his attention today with us is a real gift. Thank you, Dr. Spaeth, for being with us.
Thank you, Nancy. Thank you. I'm glad to be here because this is the leading cause of irreversible blindness in the world. The leading cause. More people are blind from this condition, glaucoma, than any other thing, and you can't get your sight back.
Right.
But you don't need to go blind.
Right.
So the opportunity to speak to people and share this knowledge is a great opportunity. I'm delighted to be with you.
Well, thank you. And we're delighted to really learn about this because even a lot of healthcare professionals will learn something from this today because of his incredible background and experience. After you've treated hundreds of thousands of people, you know a whole lot more than is just in the textbooks. So tell us about how you got passionate about this. You could have gone into many other areas of medicine. What really got you interested in glaucoma?
Well, it was really just chance. So that was chance that I got interested in glaucoma, that I got into the field of glaucoma, but once in it, then I realized that this was enormously important. Mm-hmm. And it's enormously important because I look at you and you look fine. You have nice looking eyes, everything looks fine. There's nothing that could indicate that maybe she's not even seeing in one eye. She may not even know it. Or that maybe tomorrow she'll have an attack of glaucoma and lose the sight in the only eye she has. So it doesn't show. It's not like polio,
right,
or arthritis,
right,
or a heart attack. This is something which you have to be really knowledgeable about, and you have to have other people help you. And if you do that, have other people help you and do some pretty simple things yourself, you can almost always keep your sight from being stolen by glaucoma.
Right.
So I'm passionate about that.
So you saw you could really make a difference.
Absolutely.
Right. and as you are doing with us today. So I think for our listeners, people want to know, what is it? You know, how does it happen? How often does it happen? Just give us some background on the condition.
Well, Nancy, one of the things about glaucoma that's a little confusing is it's not really a thing. It's not like a cancer on your skin that you can cut out. It's a process. And what's a process? A process is the way things happen. You know, when you want beer, you brew it. Brewing is the process by which you make beer. You end up with beer. Now, glaucoma is a process. It's the process by which the nerve that connects the eye to the brain becomes damaged. And that damage is related to the pressure inside the eye.
Which you can't feel.
You can't feel that unless it gets very high. If it gets very high, you get excruciating pain, worse than a kidney stone, very similar to the sort of pain of childbirth, very severe. But that's rare. Usually, glaucoma pressure is just a little high, and you don't feel that at all.
Right.
So glaucoma is this process by which the nerve in the eye becomes damaged. And all kinds of things can cause that. A blow to the eye, getting hit in the eye, having cancer that spreads to the eye. You can get it commonly by the drain getting blocked by the colored part of the eye, blue or brown or whatever. That can block the drain. Then the fluid can't run out because the eye it's like a camera. And it has, at the back of it, it has a film. And it's a living tissue, so it has to have sugar and oxygen, or else it dies. And the thing that keeps the eye firm and that nourishes it inside is fluid. So the fluid flows into the eye and then has to flow out of the eye. Well, if something blocks the drain so the fluid doesn't flow out, then the pressure in the eye gets hard. And if the pressure gets hard, then it damages the nerve. So it used to be thought that that's what glaucoma was, that glaucoma is high pressure. And certainly high pressure can damage the nerve.
Right.
But it's much more complex than that. People can have normal pressure and yet still go blind from glaucoma. You can have no pain, no symptoms, and yet go blind from glaucoma. And how can that happen? Well, there are lots of people all around the world studying. It can be due to the way the blood vessels regulate themselves. There's something called auto-regulation, so that when the blood pressure goes up, the blood vessel constricts or dilates. Well, that can happen in the tissues that supply the nerve, and some people have cold hands. When they go out in the cold, their fingers get all white. Those people are predisposed to getting a type of glaucoma in which the blood vessels around the eye, inside the eye, also constrict. So like rather getting cold hands, you get a cold nerve, you don't get enough blood to the nerve, and the nerve dies. That's one sort of glaucoma. There are all kinds of different kinds of glaucoma, but they're all related to the nerve becoming damaged.
Right. So I think what George is telling us is that there may be different causal factors, things that contributed to any particular situation where glaucoma exists. But the end result is the same, and that is when the nerve is damaged, you can no longer see. And I think he's going to show us some visuals of this, because even if you don't understand these pictures, that's okay, because you're going to see something that you will not see in your doctor's office, but this is what the doctor is looking at when they are looking into your eye, doing an exam for glaucoma or just doing a basic routine exam. They are looking at the back of your eye, which is referred to as the retina. So would you be so kind as to walk us through these visuals so you can help our listeners see
Sure.
what it looks like when it goes from okay to bad?
What you see on the screen now is a sort of a white, yellowish orange dot in the center of, or off to the side of a kind of an orangey thing. All that orangey area, that's the retina. The retina is the part of the eye that's the film that contains sensors, so that when the light comes into the eye, it triggers those sensors, and that electrical current is sent back into the brain, and that's what lets you see.
Right.
Now, if you look back at that nerve again, so we can show that same picture again, it looks a little bit like a donut. There's a hole in the center, then you see some blood vessels on it, and you're looking at the end of the nerve. So when I look at Nancy and I look right here, I look right into her eye with that little instrument.
Right.
That's what I see. I see that nerve. It's going from her eye right back into the brain. It goes from here right back into the brain. That's a healthy nerve. That's a really nice, healthy nerve, because it's not lost any blood vessels, it's not lost any tissue. Now, if we look at the next picture, that's a pretty healthy nerve, too. What you can see is that the rim, the orangey part, has gotten narrower, and the center white part has gotten bigger because that narrower part's being pushed aside, and the funnel in the middle is getting bigger. And then if we look at the next image, what you'll see here is, gee, there's no donut left. Now there's just a hole. There's a big cup. And all that tissue has been pushed out to the side. It's all dead. So when I look into that eye and see that nerve, I know that person's blind. They don't see anything. That's what you want to avoid.
Right.
Because once you get there, you can't get that back.
Right. And I think the value of looking at these pictures, as I said, the average person is not going to really understand all the fine points of those photographs. But the take home that anybody is going to understand is that once it looks like that third picture, there's no hole, there's no drainage, the nerve has been permanently damaged. This cannot be reversed. There is not a surgical procedure. There are no medications that are going to change this. And that's why this show is so vital to your health. It may not be yours personally, but you may know other people. And so you want to help them not have an eye that looks like that last picture that we just looked at.
Yes, and you said, of course, it may not be you, but this is a common disease. Well, common, that's one of those strange words. Let's put it into specific figures. About 2% of people in the United States, that's 2 in 100. That's not a lot unless it's you. That's across the board. But when you look at specific groups, for example, as you get older, you're more likely to get glaucoma. If you are a Hispanic person, by the time you get to be 80, you have 1 in 4 chance of having glaucoma. 1 out of every 4 people, Hispanic people who's over 80, has glaucoma.
That's an amazing statistic. Do they have any idea why?
No. It's a little less common in people of black ethnic background, but also with age it becomes much more common.
Right.
So when you get to these, if you're black or Hispanic and you're 70 years old, you better get checked, because you have a very good chance that you may go blind from glaucoma.
Right. What do you think about having your eyes checked on a yearly basis? We had another show where our speaker brought up a very interesting point, and that was we really tend to go get our teeth checked on a yearly basis. At least that's what we're encouraged to do. But eye exams don't seem to be that frequent. People sort of figure if they can see okay, then that's it. They don't bother.
Amen. Have you seen the movie All Is Lost?
No.
It's a movie about Robert Redford made, and the take-home message from this amazing movie is you can't do it yourself. You have to have help. There's certain things you can do, but you can't see parts of your eyes that I can see, and I can look at you and say, as I saw a person yesterday, this was a friend I was going to a dinner with. I'd never been to dinner, and I met this person and said, may I see your glasses? Because they had kind of glasses that you wear when you're looking out in the distance. I said, you know, you got to get checked, because there's a great likelihood that you have glaucoma, because you're very farsighted. Now, this person had seen a doctor periodically, but the doctor has to know what to look for. And if the front of the eye is made so it's very shallow, so there's not much room for that drain, you can't see anything. You feel fine. You have no indication whatsoever that you're a time bomb. But if that angle closes, the pressure goes up, and that's the single commonest cause of irreversible blindness in the world, angle closure glaucoma. And it's totally preventable. So you feel fine, but you may be a time bomb.
Right. So how often would you, as a physician who has so much experience with people getting into really deep water before they know it, how often would the average person be counseled to go and have their eyes checked?
Well, I have to rise the word average, because there is no average person. So let's not talk about average people, because nobody's average, nobody's standard. If you need glasses for distance or near, get yourself checked, because you're more likely to have glaucoma.
Okay, so any eye condition really
Anything
warrants
that you
it.
need glasses.
Okay.
If you have a person in your family who's lost vision suddenly, especially suddenly from glaucoma, get yourself checked, because it runs in families.
Right.
If you're older, get yourself checked. So what's older? Well, certainly if you're 70 or 80, you want to get a yearly examination for sure. And actually, I would suggest, Nancy, a good way to think about it is somewhere when you're fairly young. 20, 25, 30, somewhere through there. Get a really good examination and have the doctor make some baselines, because everybody's unique. And what you need in order to determine that something's bad happening often is what was there before and what's there now.
Right. Now explain what a baseline
A
is and what
baseline
it
is
looks like.
What's the pressure in the eye? What's the nerve look like?
So
You
actual
get an
pictures,
image,
right.
Take a picture of the nerve.
Okay.
Get those baselines. And then maybe, if everything's fine, maybe don't go back until you're 50. And then if everything's fine when you're 50, go back when you're 55. But if you go back when you're 50, the ophthalmologist says, you know, I think you've got a little bit of a narrow angle. I don't think it's enough that we need to treat it, but I want to see you next year. You say, well, I feel fine. I know, but this is the way you're made, and this is going to predispose you to get in some trouble. So depending upon what's found, then you can schedule the frequency of your examinations, because
Right.
this is a common disease, but it's commoner in certain people.
Right. So you have to really know yourself.
Family history,
Right.
your genetics, whether you're nearsighted or farsighted. It's commoner in certain types of glaucoma, or common in people who have diabetes, things like that.
Right. Now, in addition to the professional visits, Dr. Spaeth was saying that there are ways that we can check our own vision. So he's going to show us what's entailed with that, so that we can really adopt this as a regular habit.
Thank you. Okay, now you're looking at me, and of course you see me with both eyes, that is to say, if you're healthy and normal. That's different from the right hand, which is doing right hand things, and left hand doing left hand things, or the other way around, because the two eyes are looking the same place, and they both overlap. So when I do this, I still see you. I see you just fine. So I can lose the sight almost completely in one eye and not know that anything's happening. And strangely enough, it's not at all rare for a person to come into the emergency ward to see a doctor because they're gardening and a stick gets in their eye, and they blink their eye and they say, oh my gosh, I can't see with my other eye. It's quite routine to see people who've lost half their vision before they even know it, or
Right.
maybe even more.
Right.
Sometimes they become I remember a tragic story. This was one of the workers in Will's Eye Hospital. She came to see me because she said, you know, I can't do my work anymore. This eye was totally blind, and this eye had far advanced glaucoma. And there she was right in the hospital, but she'd never checked her vision. So what you can do yourself is just check one eye at a time. What do you see? Check the other one. They should see about the same thing, and if one eye isn't seeing as well as the other, you better get examined pretty quickly.
Right. So how frequently would people add that to their general health routine?
I suggest that people do it, and this is more than necessary, but it gets worked into your routine. You know, you do, I hope people do exercises almost every day of some sort. And what I would suggest is the first Sunday of every month.
Okay.
You get up in the morning, first Sunday of every month, and you just take about 10 seconds to see whether the vision in the two eyes is the same.
Right. So something simple. I mean, you have to really come up with your own prompt for that, but I think anything that gives you a monthly check and you tie it to something else, that always makes it a little bit easier to remember.
Yes, it does.
It really does. We really do like to track on patterns, and that would be a pattern that you could add to some other part of your routine. But I think something as simple as that could really save a lot of people's sight. What would be your guess? I mean, if people started doing that, how do you think we could impact the healthcare, say, in the U.S. for glaucoma?
I think if people checked their vision themselves, I think we could reduce the amount of vision by at least 50%. Maybe more than that, at least.
That's tremendous.
Oh, it would be huge. It would be just huge. It is so... You asked me earlier, how did I get passion for glaucoma? I got passion for glaucoma. I think my mother was a very wonderful mother, and she got the message across. If you have certain talents, you have a responsibility to use those for the benefit of yourself and for others too. And when I see people with glaucoma who are blind unnecessarily, that's awful.
Right. Well, it's heartbreaking.
It's heartbreaking.
It really is.
It is.
Because let's walk right through now to the treatment. The treatment is doable. I mean, people can be treated for this.
There's a particular type of glaucoma that I mentioned at the start, the quick type, in which you suddenly get pain and you suddenly lose your vision. That can be prevented, that bad part of it can be prevented, literally 99% of the people, and it can be prevented with a simple laser treatment. You sit at a little machine, you put your head in the machine, a laser is very carefully focused on the colored part of the eye, and then that's activated. That's like a little tiny hole in there that allows the fluid to go from behind the iris to the front of the iris. That gets the drain working again. It works literally in 99% of people, and it's almost totally safe.
Is it painful?
The explosion lasts a millionth of a second. So for a millionth of a second, you get a little prick. But it's so brief that the answer is, yes, you feel it, but it's not painful.
Well, that's good, because that even adds more impetus to having it done. Because sometimes people are afraid of pain or suffering, but there's really no pain and suffering to speak of in this
Well, it's
procedure.
sort of scary. You think, my God, they're going to shoot a laser into my eye? But lasers can be very finely focused. This is very, very carefully focused, a tiny, tiny little spot, and goes poof. And from the physician's point of view, it's just miraculous, because it's like, visualize a dam, and all of a sudden you make a little hole in the dam, and the water comes pouring through, and you can see the fluid going back into where it should be going, just right while you're watching it. It's great to see.
Right. Oh, yes. Well, I can see he loves the drama of it, you can tell.
Well, it is. And it's also nice to know I've saved somebody's sight.
Right. That's the best part of the whole
Pretty
story.
nice.
How about other treatments and then the aftercare?
Well, that's That's the uncommon type of glaucoma. It's caused a lot of blindness because it's so serious. The commonest type of glaucoma occurs very, very slowly. It takes maybe 15 or 20 years before it starts to make you blind. And the real problem with that is people have to be engaged in their care because they've got to put some drops in their eyes to keep their pressure in a range which is okay. Usually the drops are going to work. But you know, you say you have to tie something to what you're going to do. You have to remember to use it usually once a day, sometimes twice a day, sometimes 4 times a day. So you have to develop a program in which you're committed to saving your sight and putting those drops in the eye. Now, sometimes the drops don't do the job, in which case there are surgical procedures that make new drains. Literally, you make a whole new drain in the eye. They work very well. They carry the risk of any surgery, potential for infection and things like that, but by and large, they work very well.
Right. So I think it can be treated, and it depends on the type of glaucoma. But I want to be sure that you understand that the treatment that Dr. Spaeth just mentioned of putting the drops in over a long period of time must be done. And some people do not comply. And if they don't comply, then they're really not treating themselves properly. And they can wind up, again, with progressed disease.
Don't mean to interrupt, but I'm glad you brought that up. This seems unbelievable, but it's true. When a person is found to have glaucoma, and the doctor says, you really have damage already in one eye, and here's a visual field we took, and you see this, there's areas out here, areas in here, you're not seeing anymore. You don't realize it because this eye is working well, but this eye is really damaged and is going to go blind unless you use your drops. Given that scenario, you'd think people would be very, very good about using their medications. Only 10% of people who are told that will be using their medications properly at the end of a year. 10%.
That's pretty dramatic when you think that the consequence is permanent blindness. They think that would be enough impetus.
But that's why it's called a sneak thief, because it's not hurting you. You put the drop in, the drop stings, maybe it blurs your vision for a little bit, and you say, this is doing more harm than whatever that glaucoma stuff is anyhow. I'm seeing fine, I'm doing okay, and I'm supposed to put this expensive drop in my eye? There's little motivation to do that unless the person really understands what it's like to be blind, and it's not nice.
Right, right. But they obviously don't believe it's going to happen.
That's right.
I want to thank Dr. George Spaeth for being with us today, because he just hit the nail on the head when he just said if people don't really understand this condition. And the purpose of this show today has been to walk through step by step what this condition entails, how it starts, what you can do about it, how you can take action, and how you may have to persevere if indeed you do have glaucoma. Because now you've seen the back of the eye, you can see how it changes. You have understood that it is not reversible, that it will change your life if you do not take your responsibility for what you can do to self-treat and self-manage this. So I think that we've really done a good job with his help walking through all the different steps to know that self-care is key, doing your monthly checks of your own eyesight with a very simple test, and knowing that your actions, as well as the actions of your treatment team, your doctor, can make all the difference in the world. This is a condition that I think you've heard, that this is a gentleman who is passionate. He has saved the sight of hundreds of thousands of people's lives. That alone is a lifetime accomplishment. I mean, we watch, the Oscars for like great movies. I think we need Oscars for people like George Spaeth, because that is fantastic. But what is even more fantastic is that he's done this show, because this show will go out to many, many people, and he will save lives through truly what he has shared with us today. So I really want to thank George, for being with us, and I really want to thank each and every one of you that have watched this show, because you and your actions and how you can help yourself and others will make a profound difference. Thank you very much for joining us. I hope you've learned something, and remember, with health, all things are possible. Thank you, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.